Okay. Thank you everyone who was able to join us here today at the College of Registered Nurses of Manitoba in ceremony as we strive to move forward in a good way. Thank you as well to those of you who are joining us via live stream for the College's public apology to the First Nations, Inuit and Métis. My name is Deb Elias and I'm the CEO and Registrar for the College of the Registered Nurses of Manitoba, and I will be your MC for today's proceedings. I would like to begin by respectfully acknowledging that our offices, our registrants, and the public we serve reside and work on the traditional territories and ancestral lands of the Anishinaabe, the Inuit, the Inishiwik, Dakota Aioti, and Dene, and on the national homeland of the Red River Métis. The College recognizes the historic and ongoing impacts that colonialization and systemic discrimination have on the health of First Nations, Inuit, and Métis, and that we must take continued, meaningful actions to advance reconciliation and effect change in the regulation of registered nurses. We respect the treaties that were made on these territories, and we are committed to moving forward in partnership with First Nations, Inuit, and Métis communities in a spirit of reconciliation and collaboration. It is in that spirit of reconciliation and collaboration that has brought us here today. As we begin work on the organization to understand how and to what extent the College could contribute to advancing reconciliation within the context of our regulatory mandate, it was clear that we had a great deal of learning to do and that we would need to face some uncomfortable truths. As the largest healthcare profession in Manitoba, registered nurses have been part of the problem and must be part of the solution in ensuring safe care for everyone who accesses care in our province. The College also had and continues to have a role in the systemic discrimination and generational harms that were and continue to be experienced by First Nations, Inuit, and Métis in healthcare. We know we can and must do better, and today's apology marks an important step in that journey towards meaningful action supporting reconciliation. With that in mind, I would like to now formally deliver our public apology to First Nations, Inuit, and Métis on behalf of the College of Registered Nurses of Manitoba. Just gonna take a little sip. First Nations, Inuit, and Métis inherent rights to self-determination, health, equal health care, and freedom from discrimination must be respected and upheld. Anti-Indigenous racism and the rupture of treaty relationships designed to protect these and other inherent rights have had insidious effects on the foundation of our settler colonial healthcare system, causing great harm both now and in the past. The Registered Nurses of Manitoba is profoundly sorry for its role in perpetuating and its failure to act in response to harms experienced by First Nations, Inuit, and Métis, both as a result of our work as a regulatory body and the conduct of those nurses we regulate. This apology is long overdue. Even though ample evidence of the harms of systemic racism affecting First Nations, Inuit, and Métis community members and nurses has long been available, we have not acted consistently, responsibly, or with the level of urgency or commitment required. We have failed to act in ways that would have guided the education and practice of registered nurses serving First Nations, Inuit, and Métis towards two of the most central tenets of healthcare: to help and to do no harm. This can and must change. Manitoba was the first province in Canada to recognize registered nursing as a profession in 1913. However, this recognition came about in a way that further privileged colonial Western perspectives with devastating impacts. Registered nurses were present in colonial systems such as residential schools, in Indian hospitals, and passed health and social programs that caused grievous physical, cultural, and spiritual harm, very often without advocating for the well-being of First Nations, Inuit, and Métis. As the professional body for registered nurses in Manitoba, we did not effectively advocate or seek to drive change that would have lessened the harm and burden experienced by Indigenous communities and community members. We appreciate that registered nurses and nurse practitioners have significant power and influence in the health system and are integral to the provision of health care. With this comes a responsibility to ensure that care is inclusive, appropriately informed, culturally safe, and upholds essential human dignity. Our duty as a regulator is to protect and serve the public and to uphold standards for patient safety. We have endeavored to do this by setting forth and enforcing standards and by providing resources that support safe registered nursing and nurse practitioner practice. However, countless reports published in Manitoba make it clear that we have failed to do so in a way that adequately responds to First Nations, Inuit, and Métis continued experiences of racism, discrimination, and abuse in our healthcare system, and the substantially poorer health outcomes that result. To all First Nations, Inuit, and Métis, we affirm our deep sorrow for the harms that you and your ancestors have experienced, and the intergenerational effects that our actions and inactions have caused or contributed to. We realize we have much work to do, and that an apology alone is not enough to effect change. We commit ourselves to moving forward in a spirit of reconciliation that is founded on building trust and in sustaining strong, collaborative, and caring relationships and partnerships with First Nations, Inuit, and Métis communities, organizations, individuals, and healthcare providers. We will also strive towards effective allyship and support distinctions-based approaches to policymaking and process reform. We pledge to become anti-racist in our work and to support registered nurses and nurse practitioners we regulate in addressing racism affecting First Nations, Inuit, and Métis patients, their families, and colleagues in healthcare. We will speak out against barriers and racism that inhibit Indigenous health and well-being. We commit to this journey with great humility, understanding we have much more to learn, and that we will inevitably make mistakes despite our best efforts. However uncomfortable it may be to recognize racism in ourselves and others, we will acknowledge those mistakes and learn from them. We dedicate ourselves to being guided by Indigenous perspectives in all aspects of our work and to broaden opportunities for Indigenous participation and belonging as part of our staff, committees, and governance structures. We will respond meaningfully and constructively to the Truth and Reconciliation Commission's calls to action and the calls for justice included in the final report of the National Inquiry into Murdered and Missing Indigenous Women and Girls through the development of a Reconciliation Action Plan. We would like to acknowledge and profoundly thank those First Nations, Inuit, and Métis elders, knowledge carriers, nurses, and partners who have shared with us the gift of their knowledge, wisdom, and truth. Their commitment, honesty, and courage in working with us to help us both learn and unlearn has been and always will be deeply appreciated. I would just like to pause for some reflection on those words before we move on to the next part. We know that meaningful apologies must be accompanied by action. The College stands ready to move forward to do just that. Our reconciliation journey did not begin today and will continue evermore. Many Indigenous leaders in nursing and healthcare, some of whom are here with us today, and have helped us to see what we could not, helped us to work and act with greater cultural humility and in promotion of cultural safety in healthcare. College staff have been working hard to build up to this point for the past several years, and advancing reconciliation is a core priority of our strategic vision for regulation. As part of that work, we have increased outreach and relationship building efforts with First Nations, Inuit and Métis nurses, organizations and communities. Last fall, we formed an Indigenous advisory group for collaborative development of our Reconciliation Action Plan, which we will deliver and begin implementation by the end of 2026. And we will continue to broaden and deepen our work and commitment to support reconciliation as our reconciliation journey continues. The Honourable Murray Sinclair defined reconciliation as an ongoing process of establishing and maintaining respectful relationships, underpinned by repairing damaged trust and following through with concrete actions that demonstrate real societal change. Today, we have taken an important step in that direction, but we understand the journey stretches out in front of us through generations for as long as the sun shines, the grass grows, and the river flows. I would like to thank you for being with us today at this moment of solemn reflection and atonement, and we hope to continue to work collaboratively with you to make needed change to advance reconciliation within the context of our regulatory mandate. I would also like to thank First Nations Elder Francis Desjardins, Knowledge Keeper Rose Hart, Inuit Knowledge Keeper Dolly Tinashlu, and Throat Singers Chastity Swan and Elitra Sumerchuk, and Red River Métis Elder Louise Lavalley for leading us in ceremony today and for the gift of their knowledge, wisdom, and cultural teachings. So this officially brings our live stream to a close. So I'd like to thank all of those who joined us online for their presence here today.